received for March. As stark as those numbers are, they aren't a surprise for a lot of Canadians. Each one represents a different story. A worker who's been laid off, a family that's having to hunker down, a community that's anxious about today and tomorrow. We've all seen the impact of COVID-19. We all knew this was going to be a tough time and that countries around the world are in a similar situation. But that's no comfort if you're out of a job, if you're having difficulty making ends meet. You need real support. So we're doing our best to help you bridge to better times. On Monday, we launched the Canada Emergency Response Benefit. More than 4.5 million claims have been processed, which means people are already receiving their $2,000 for this month. We're also working on legislation to bring in a wage subsidy to help employers keep people on the payroll while working on new loans for business owners. We will keep expanding our 3-point economic plan to protect jobs, support business owners, and get everyone the help they need. Things will get better, and once they do, you can be sure that our country will come roaring back. As a country, we've gotten through tough times before. We've stood together, united and strong. On Vimy Ridge, more than 100 years ago today, thousands of Canadians gave their lives so that our country would know peace.
Today, we remember those who fell at Vimy more than 100 years ago today. We remember the sacrifices that they made for our country. They fought to defend values that are dear to us, such as equality and peace, for values that still define our country.
Historians have noted, reflecting on Vimy, it was a moment ordinary people did extraordinary things. Fathers and sons, brothers and friends, their sacrifice and courage defined what it is and what it meant to be a Canadian. And their legacy lives on in the women and men who continue to step up and serve us in uniform, in our nurses and doctors who put themselves in harm's way for us all to stay healthy, and in everyone who steps up and asks what they can do for their fellow Canadians. That's what makes Canada strong, and that will be our path forward, no matter what tomorrow may bring. Right now, the future can seem even more uncertain than normal. If you've lost your job, if you're worried about an elderly parent, you probably want to know what to expect. Earlier today, we released our modeling on how we think this pandemic might unfold. The modeling shows that COVID-19 arrived in Canada later than in other countries. So we're in an earlier stage of the outbreak. That means we have the chance to determine what our country looks like in the weeks and months to come. Our healthcare systems across the country are coping for the time being, but we're at a fork in the road between the best and the worst possible outcomes. The best possible outcome is no easy path for any of us. The initial peak, the top of the curve, may be in late spring with the end of the first wave in the summer. As Dr. Tam explained, there will likely be smaller outbreaks for a number of months after that. This will be the new normal until a vaccine is developed. But as we saw, that is so much better than we could face, all of us, if we do not rise to the challenge of this generation. The path we take is up to us. It depends on what each of us does right now. It will take months of continued, determined effort. We'll need to keep practicing physical distancing, staying home, and washing our hands. It will help. It will help get the numbers that Dr. Tam was talking about, between 4,000 and 44,000 deaths, as low as possible.
I know that Dr. Tam and the entire team at the Public Health Agency have worked very hard to prepare those projections and to ensure us that all the information is up to date. We are in constant communication with the provinces and territories to get their latest data. Earlier today, we released our projections. The models show that COVID-19 arrived in Canada later than in other countries. Therefore, we are still in the early stages of this epidemic. That means that our actions are even more important in terms of determining what our country will look like in the weeks and the months to come. For the time being, our healthcare system is holding strong, but we are at a crossroads. The path that will take us to a better result will not be easy. We could reach the peak at the end of the spring, and the first wave could end in the summer. But as Dr. Tam explained, we will probably see other outbreaks, smaller outbreaks, for a certain number of months. It is and will be our new reality until we find a vaccine. But as we saw this morning, it's a better scenario than what could happen if we refuse to act. The path we take will depend entirely on all of us. We will have to be disciplined in the next few months. We will have to continue to stay home and continue to wash our hands. That's how we can avoid the thousands of deaths and reduce the number of cases.
I know it's tough to stay home, especially as the weather gets nicer. If you have kids, it's even tougher. But to get them back outside and running around the playground and park as soon as possible, you need to keep them inside for a little longer. This will work, and we'll be with you every step of the way. Just this week, we received millions more masks to keep our frontline workers safe, and we have contracts to get more ventilators. We're helping industry mobilize, like the entrepreneur from Vars, Ontario, who's creating reusable visors for hospitals across the province. And we've continued to support Canadian researchers working on a vaccine. We're pulling out all the stops to beat this virus and help you get through this time. On doit tous faire notre
We must
part.
all do our
Les
part,
gouvernements, les entreprises,
governments,
et les
businesses,
citoyens.
and citizens.
Continuez de
So
rester chez vous.
continue to stay
Allez faire
home.
votre épicerie
Continue
une fois
to
par
do your
semaine,
groceries
et seulement
once a week,
une fois par semaine seulement,
only,
ou encore moins seulement,
or
moins
even
souvent.
less often than that.
Si vous devez sortir,
And if you
gardez
must go out,
2 mètres de
do
distance
keep a 2-meter
entre vous
distance
et les autres.
between you and other
C'est
people.
comme ça
That is how we can protect vulnerable people. That is how we can protect our seniors. That is how we will save lives. And that is how we can help our nurses and physicians who are doing extraordinary work every day. I know it's not easy, but it won't last forever. At some point, we will be able to go back and watch a film or go to parks. But for now, everyone must do their part, now and for the coming weeks.
Over 100 years ago today, Canadians showed what metal we are made of. I know each of us will rise to be worthy of the legacy of the heroes that built this country. We can do this together. Merci tout le monde.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant passer à la période de questions en commençant par le téléphone. Modérateur, c'est à vous.
Merci. Thank you. La première question est de Michel Lamarche, TVA Nouvelle. À vous.
TVA Nouvelle.
Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to hear you comment on these waves that Dr. Tam referred to earlier. I'd like to know if, seeing that this could continue into December with more outbreaks, you are prepared to renew all of your aid programs until then. We will be there to help Canadians as long as they need help. But we all know that the time this will take depends very much on what we're doing. Canadians have to continue to stay home. On whether they do that, or on whether we continue aggressive testing, or on whether we continue to do aggressive contact tracing. If we do that, we'll be able to meet those minimal projections and come through this first wave. Yes, there will be other waves until there's a vaccine, but those waves will be much easier to manage with the knowledge and the equipment we have now, and through Canadians' new habits and their ability to keep themselves safe.
We recognize that what we are doing today is making a difference, and we are hopeful that we're going to be able to get through this in the shortest amount of time. But no matter how long it takes, we will be there to support Canadians in order to get through this. We know, though, that in order for it to last as short as it can and to harm as few Canadians as possible, we need to keep doing what we are doing. That is what leads us to the best scenario. And once we're through this first wave, as we look to the resurgences that will happen over the coming months until we discover a vaccine, now, we will be much better equipped, both with aggressive testing strategies that we're developing right now, with aggressive contact tracing, and with Canadians who know what to do when they have to socially distance, to stay home where and when necessary in the coming months.
Suivi.
Follow-up?
Yes,
we understand, Mr. Trudeau, that helping Canadians has no price. But I'd like to know whether there's an assessment of the cost that's been done over the next few months, and can we afford to spend hundreds of millions of dollars more, possibly until December? That is one of the reasons why it is so important to come through this first wave as quickly as possible. That is why that in the coming weeks people will have to stay home and limit their movements as much as possible. When we come through this first wave, as we saw in the modeling, we will be able to open up the economy to a certain extent and set aside some of those restrictions as we manage the new reality, so that economic activity can start up again. Of course, everything depends on what we're doing now. However long this may last, we will be there to help each other, because that's what we do as Canadians. And we know that if we want to get back to a normal life at some point, people need the necessary support to come through this.
Thank you. Merci. The next question, Mia Rabson, the Canadian Press. Line open.
Good morning. I'm just wondering, given the new projections today, do you think that we're going to have stronger measures necessary to keep people at home? Do you think people are listening? And what are those measures that you think we might need to add?
We have seen that the measures that have been taken seriously by Canadians right across the country. People are staying home. People are choosing to go out only for necessities. They are working from home as much as possible. And these are the measures we know are going to keep us on the right path. Are there things we can do to strengthen and improve? Sure, and we'll keep looking at those. But the big things that we're going to be able to improve in the coming weeks is stronger and more sophisticated and aggressive testing protocols, because every day we get better at that, and continuing to develop tools for better contact tracing. We know that those things, on top of the social distancing that we're doing right now, have the best impact on keeping this curve as short and as low as possible.
Follow-up?
I'm also wondering if there are going to be multiple waves of this, if we aren't going to be able to sort of get out of this until we find a vaccine, which we're told is 12 to 18 months away at best. Do you envision that we're going to have multiple waves of shutdowns, lockdowns, closures of the economy? And how can we handle those kinds of constant shutdowns?
I think even after we're through this first wave, we will need to remain vigilant and we will need to bring in different measures. Normality, as it was before, will not come back full on until we get a vaccine for this. And as you say, that could be a very long way off. But once we get through this first wave, we will have developed both tools and habits that will allow us to be much more resilient and resistant to further outbreaks and spreads that will be able to be kept localized, that will be able to fight against and protect our most vulnerable from over the coming months. It will require continued actions in different places and quick responses. But part of getting through this wave in a rapid way will be because we are developing the tools that will also help us when those wavelets come forward in the coming years, in the coming months. Okay.
What we are seeing is that even if we come through the current wave, we will not be able to return to normality the way it was before until there's a vaccine. And that could take a year or a year and a half. We don't really know, but we hope it'll come sooner. But our ability as a society and the ability of our system to respond to these small waves and these small challenges that we'll face with these more localized outbreaks with better tools will allow us to start up economic activity again, but we will have to remain vigilant in the year to come.
Thank you. Merci. The next question, Maura Forrest, Politico. Line open.
Yes, thank you, Prime Minister. Today, obviously, there's been a lot of grim announcements that people have had to take in, both in terms of job numbers and in terms of these projections. They're getting this information as they're heading into a holiday weekend when they're being asked not to celebrate with their families. I'm just wondering how you think Canadians should react to this today.
I think, obviously, this is difficult news. This is news that reflects, particularly in the job numbers, a reality that millions of Canadians have been feeling over the past weeks. That the real impact on not just our economy, but on the lives of Canadians, of workers, of families, of communities, is significant and real. But what we're also seeing in numbers from different parts of the country is that there is a light at the end of this tunnel. That if we keep doing the things that we're doing the way we're doing, as we've seen in other countries, we are able to minimize the level of the impact of this wave of COVID-19. We are unfortunately going to continue to lose people across this country in the coming weeks. But we also know that there are things that we can continue to do to make sure we get through this first wave as quickly and as low impactly as possible. That's why, as we gather with the immediate family members that we're sharing a home with right now, as we FaceTime to our loved ones and reflect through this Easter weekend, we need to know that we will continue, we can continue to do what is necessary for the coming weeks and months to get through this first wave in the right way, so we can get back to being there for each other in the coming year.
Follow-up?
Yes, thank you. Dr. New this morning said he was going to be celebrating this weekend virtually with his family. How will you be celebrating?
I'm hoping to be able to see my family this weekend. Of course, the priority is ensuring that we're getting the legislation passed. Conversations are still ongoing with members of the opposition parties. We know that we need to pass this legislation to get the help to people that is needed. That's why while we continue discussions around democratic processes and defending our institutions, which will be ongoing, which is really important to me and to all of us, we need to move forward on getting this legislation moving through the House so we can get the help out to Canadians, and that is my focus this weekend.
En français.
Okay.
I hope to be able to spend some time with my family this weekend, but the reality is that our priority is to get this legislation passed so that we can help even more Canadians and get that aid out to workers and businesses. And that's why we are in discussions with the opposition parties. Of course, we need to ensure that our democracy continues to work and that our strong institutions are there for us in these difficult times. But we must absolutely bring back the House of Commons to pass this bill so that we can help people. And I do hope that the opposition parties will agree with me in saying that Canadians cannot wait.
Question, modérateur.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Good morning, Mr. Trudeau. With respect to that bill, we understand that the Conservatives are saying that Parliament will have to meet in person, in reduced numbers. That is the condition for their agreeing. Now, why is this their condition? First of all, we're very open and we're prepared to recall Parliament to pass important legislation and do the job that people expect us to do as a government and as a parliament. But we also know that we must follow the recommendations of healthcare experts and not assemble people if it's not absolutely necessary. There are virtual means available, and even if we meet in reduced numbers, there are security officials and other people who will be there and must be there to help us. But we want to minimize any impact. And of course, we want to continue to seek ways to work together and ensure that we can keep our strong democracy and our strong institutions working. We're very open to that, but I think we're in a time now where we should not be preventing the passage of important legislation just because you want to keep talking. So those discussions will have to continue. And with respect... I'll just answer in English.
It's extremely important that we do have strong democratic institutions that continue to function to serve Canadians, to get the help needed to Canadians, and provide that input from voices across the country on the impact that things are having in their community. That is essential, and we're going to continue to talk with opposition parties about how we can make sure that our institutions and our parliament continues to function. It is something to remember that when we do gather in smaller numbers, first of all, it still requires a significant number of support staff to come into work to be there while Parliament is functioning, and that puts them at risk as well. But it's also something that doesn't allow for members of Parliament who live in further off parts of the countries to be weighing in and make sure that their communities are being heard. That's why we are so interested in looking for virtual ways of gathering the House, and we're going to continue to work on that. But it's, I think, really important that parliamentarians get together to make sure that the work of getting the help to Canadians happens and happens quickly while these continued conversations about furthering our democracy in this moment of crisis continue. It's not the time to further delay getting help to Canadians.
And a sub-question, Mr. Scheer is saying that none of that is a problem because in any case, the infrastructure to get that subsidy out there is not ready and it couldn't be given to them right away anyway. So do you consider that the Conservatives are responsible, or are you responsible because you're unwilling to make a compromise? I'm a little disconcerted comforted by that comment if Mr. Scheer actually said that, because we believe that debate and discussions in the House of Commons are often a place where we see the impact and we can adjust our legislation to get even better outcomes. I don't think any party, even a party that's in government, knows exactly everything that's going on in every circumstance. And the federal government has an important role, and the opposition also has an important role in improving legislation, even in the midst of an emergency. So for me, recalling Parliament is not just getting them to, give their stamp of approval. No, it's because we have an opportunity to debate and do the right thing for Canadians. And if that is what Mr. Scheer said, I'm a little disappointed in his lack of understanding of the importance of informed debate in Parliament when looking at legislation.
If indeed Mr. Scheer suggested that the debate and discussions had by parliamentarians around a given piece of legislation don't really have an impact, I choose to disagree. I think it's really important that we hear voices from every corner of the country on the potential impacts or potential improvements to the bill we're putting forward. I think that's how Parliament is supposed to work, and that's how Canadians consider that Parliament is supposed to work. So I very much look forward to the debate on our wage subsidy to see how it's going to impact and hear from every corner of the country as much as we can on how we can make sure that it's doing the right things for Canadians. Parliament matters. The debate that happens in Parliament matters, and you can't just shrug it off like a rubber stamp that doesn't matter, because I know how deeply it matters that we have proper and robust debate on this.
David Thurton, CBC News. Prime Minister, documents show that the government has been preparing for a pandemic for over a decade, since the outbreak of SARS. But we're seeing now that, it seems like the government has been caught off guard, and Canadians are paying up the price for that. What went wrong in your planning?
I think we've seen countries around the world caught off guard by the nature of this epidemic. The challenges that we've faced in terms of getting Canadians protected are echoed in challenges faced around the world, and some countries are handling it better than others. I think Canada has done a good job of keeping on a path that is going to minimize as much as possible the reality we're in right now, and that's why we need to continue to do the things that we're doing, staying home, contact tracing, aggressive testing, and why we need to continue to listen to experts on next things we can do or other things we need to do to ensure that we're having the minimal possible impact on Canadians. And of course, there'll be lots of lessons learned from this, as there were lessons learned from SARS, and we're going to learn them and bring them into play.
What went wrong in the government's planning?
I think we all know that this was a situation that we're adjusting as best we can to. We took the advice of experts. We moved forward in significant ways. As we look back at the end of this, I'm sure people will say, oh, you could have done this a few days before, or maybe you did this one too quickly and you could have taken a few more days to reflect on it. Every step of the way, we make the best decisions we can, given the information we have. And if it's not exactly right, we fix it and we try and get it better as we move forward. I think that's what Canadians expect.
Hi, Prime Minister. Molly Thomas, CTV National News. Your government says they're negotiating with the opposition right now. Can you help Canadians understand what is the holdup to recalling Parliament? This wage subsidy is sitting on the table. There are businesses we're talking to on the brink of bankruptcy here. What is the holdup right now?
My understanding is that the legislation itself is largely seen as the right solution by other parties. They may have little tweaks and improvements to make, and we look forward to working with them on suggestions or amendments that they have. But there seems to be a sense from the official opposition that this is a moment to define or determine how Parliament will function in the coming weeks, and they are negotiating around the structures. We've said we're of course happy to have these conversations. We've put forward some proposals around things that we think could work to both minimize the risk to Canadians while moving towards a virtual parliament and ensuring the debate and accountability that is so important in our democracy. And we just hope that the official opposition will choose to realize that we need to pass this legislation quickly to get the help out to Canadians as quickly as possible. Okay.
My understanding is that the bill per se has the general support of the opposition parties. They recognize it is important and they may want to propose certain amendments, and we're certainly open to that. But the official opposition is insisting that this is a time to determine what Parliament should look like in the coming weeks and bringing in very strong measures. And of course, we're open to talking about this, but we believe this should be done in parallel with the normal legislative process because the bill needs to pass as quickly as possible in order to help Canadians as quickly as possible.
Canada having fiscal firepower. The government was planning for 4 months of uncertainty here, at least in emergency funding. How long of a financial rope do we have here, and should we be rationing that emergency funding and at all, knowing that we're in for a year here of self-isolation on and off?
We had made the decision early on that we needed to be aggressive and broad in getting help out to Canadians, and that's what we did with the Canada Emergency Response Benefit and the wage subsidy. And we've moved very, very quickly, and we are continuing to fill gaps and look at areas where we can do more to help Canadians. We will continue to do that. But we knew that our best chance of rebounding from this strongly and getting back to the extraordinarily successful country and economy that we've had, that we've built over so many generations, is to ensure that Canadians are supported through this, however long it takes. Now, we are extremely hopeful that we will be able to begin to restore a certain measure of economic activity in the coming months after this first wave is passed. But we will make sure that every step of the way we're giving Canadians the support they need to be able to keep themselves safe, to do what is necessary to keep us all safe, and to ensure that as we get going again, Canada continues to be successful for all Canadians.
En français.
Okay. Nous reconnaissons
We recognize that we had to bring in broad measures quickly to help as many people as possible. And that's what we did with the Canada Emergency Response Benefit and the wage subsidy. And we will continue to do whatever is necessary as long as it is necessary. We hope it'll only take a few months for this first wave, and that will allow us to start getting things back on track economically, getting people back to work with additional measures so that we can continue to succeed as a country. But whatever time it takes, we will always be there to support the Canadians who need help. Radio-Canada, you say it may take a year or a year and a half before we return to normal. Does that mean a year or a year and a half before kids go back to school or people go back to work, or we can go to a park with our family or attend concerts? Is that what you're telling us? Is that the normal you're referring to? What I'm saying is that until there is a vaccine available, the reality of COVID-19 will still be with us. So for the months that will take, and there are some estimates that say 6 or 8 months, some say a year or a year and a half, we will have to be vigilant. We will have to have measures followed as part of our normal life, and at the same time we will have to have measures ready to introduce if there's a resurgence of the virus in certain areas of the country or under certain conditions. But once we've come through that first wave, we want to be able to allow some economic activity to start up again, and that's why there will be a graduated return to normal economic activity compared to now. But I think it's important that people understand we'll have to be vigilant for a year or a year and a half. There are things that we will not be able to do, but there will be a lot more things that we will be able to do. And that is if and only if we come through the next few weeks and the next few months properly. And that's why we are going to have to remain in this current phase for some time. Do you think that the level of tolerance of Canadians is where exactly? How long can they stay in this kind of confinement? There are some people who are isolated, who don't have any doctors. Some people are not there for them. The government is not there to help them. What do you say to those communities that need help now? Well, we have seen some difficult things happen in the past. When we think of generations of Canadians who have made sacrifices in the major wars, including Vimy 100 years ago. But there are Canadians right across the country that have made sacrifices for many years in order to build the country that we have today. Now, I know that it's difficult, what we're doing now and what we're experiencing, and that's why the government is there to help vulnerable Canadians, to help people who are losing their jobs, to help people that need to support their families, and particularly to help and protect our frontline workers, whether it's in the healthcare system or our grocery stores. These people ensure that we'll be able to come through this and meet this challenge the right way. So we will continue to be there for each other, we will continue to lean on each other, and we will come through this because we're strong as Canadians and as a country. Now, with respect to the Indigenous people, we're very concerned, and we have been very concerned from the outset about the vulnerability of those communities, and that's why we have made investments. We made investments right away to improve the resilience of those communities. But we know there's still a lot to be done, and there have been a few cases in certain communities, which is very much a concern, and we're working very seriously on this.
President Trump is looking at tariffs on imported oil aimed at getting Saudi Arabia and Russia to reduce the flood of crude oil swamping the market. Is Canada looking at the same to support our oil and gas industry? And if not, what is the government going to do to support the industry?
I can tell you that our Minister of Natural Resources, Minister O'Regan, is closely coordinating with his counterpart, the Secretary of Energy in the United States. We recognize that the North American market and oil production sector needs to stand together on this, and we're working very closely with our counterparts and our NAFTA partners to ensure that we have a strong and united front in dealing with this global situation.
Prime Minister, Sean Silkoff from the Globe and Mail. My colleagues today wrote about the fact that Ottawa had a playbook for a pandemic 14 years ago. It was co-authored by Dr. Tam, and subsequent audits flagged problems with Canada's emergency stockpile of medical equipment. You said just a few moments ago that you were caught off guard, but given all the pandemic preparedness done here in Ottawa going back to 2006, and how some of the plans, like having enough medical supplies in our stockpile, have come up short, what will your government do to fix that going forward?
Well, I think we've already seen, and we spoke about a number of times in the early days of this pandemic, how there were significant lessons we learned from that SARS epidemic. There were things that were done or were not done in 2003 that led to significant changes in our approach on public health. And Canada was better positioned than a number of countries around the world to respond to this pandemic because we had and learned from the experience of SARS. Similarly, as we go through this time, we will learn more things about how to be even better prepared next time, if this ever happens again, as it is likely that it will in the coming decades. We need to make sure that we have the tools necessary to keep Canadians safe, and that is something that keeps evolving every single day. We will listen to science, we will share the best recommendations with Canadians, we will lean on each other, and we will get through this together. It's what we do as a country. Merci.
Merci beaucoup. C'est ce qui met fin à la conférence de presse d'aujourd'hui.
Bonne journée.
All right, that is the Prime Minister of Canada giving his daily COVID-19 briefing and returning to his home.